So now when we get into neck lifting, this is the traditional, we call it a corset neck lift. So ideal candidates for this are those that have a strong chin, a high hyoid bone. So if you look down here, you'll see this red bone highlighted. It's the only bone in the body that does not meet any other bones. It's the hyoid bone in the neck. And so patients who have this up high, this is the limit to what we can lift. So if you look at this patient's neck contour, this is the limit. We can't lift beyond that or we start, affecting the airway. So we would never do that. So we use that and we can kind of feel around on the neck and determine how good of a candidate a patient is. So if they have a nice strong jaw here, a nice high hyoid, we see that we could get a really nice result with them with a traditional corset neck lift. It helps to have medium skin thickness, and any patient who has platysmal bands, this is the treatment of choice, is to weave these platysmal bands together and get a nice neckline. Not a lot of recovery with this. You do get an incision underneath the chin. It hides very, very well, and it's typically about 3 centimeters long. About 5 to 7 days of downtime. You can get a little bit of bruising, but not much at all. The most common reason that we do this is combined with a facelift procedure. So if we're doing a facelift with incisions around the ears, as you can kind of see here, we most often will combine that with a corset neck lift. It really completes things, and it really that way you're pulling both centrally and laterally to get the contour that you want along the jawline here. About 93% of patients will say this is worth it as an isolated procedure. When we move to talk about deep neck lifting, as I said, this is a relatively newer procedure. Some select surgeons were doing it kind of historically, and 10, 20 years ago. But in the past 5 years, this has really taken off, especially in patients, a younger crowd with heavier necks. So this is a partial excision of any of the deep neck structures. So if you look in here, this is right here. This is one of the muscles that we talk about. This is the digastric muscle. Here's that submandibular gland, the spit gland. And then you would see that there's some fat in here as well. This is the deep neck fat. So if we go to excise or reduce the size of any of those structures, we would call that a deep neck lift. As I said, it's popular within the past 5 years or so. It definitely is a more powerful neck lift, and in some patients, they require it. If patients have really large spit glands here that are dropping down into the neck, if you just did your corset platysmaplasty or corset neck lift and didn't address that, that would be fairly obvious postoperatively. And it's allowed us to expand what we call the indications for neck lift. So it's allowed us to perform neck lift and get a really, really good result in patients that previously would have been considered poor candidates. I will say that this is another procedure, just like the deep plane facelift, anything with deep neck lift, deep plane facelift, you're going to want to go to a surgeon who feels comfortable working in these structures, potentially someone who works a lot in the head and neck rather than other places in the body. And that's because when we're dealing with, excising these sorts of glands and things, there are nerves and blood vessels that are in the area that you just have to be aware of and keep safe.